So we are talking with Dr. Edwards this morning. A lot of kids are wanting to get back out into their summer activities as we head closer to summer. So we're going to check in with Dr. Amy Edwards live from the University Hospitals. Doctor, thank you for being here. Before we even touch on kids getting back into events, our top story this morning is now that the COVID cases are on the rise and the different variants. So address that first before we get into if it's even capable for these kids to get back into even playing baseball.
Yeah, so hi, thanks for having me. So what we've been seeing over the last couple of weeks is that we had kind of reached like a plateau, and a lot of us have been warning for a while that it wasn't a low enough plateau, and we were worried we needed numbers to go down even further. The variants are coming. Now they're here. We're seeing an uptick even here at university hospitals. The percent of our positive cases that are from variants is going up. We know those variants are more contagious, and so they're spreading, and we're seeing our numbers go up.
So when we talked this morning about kids getting back into baseball or even swimming, that we had even talked about during the pandemic about how maybe that would be safe because of the chlorine and social distancing outside. What do you think is safe as these families start to sign their kids up?
Well, a lot of it's going to depend on, your local environment, how many adults, in your group are vaccinated. So for instance, if, most of the parents are vaccinated, if the coaches are vaccinated, if the refs are vaccinated, that's a fairly safe, activity, I think. If you're looking at a lot of unvaccinated people who aren't wearing masks, that's, not as safe. And so it's really kind of almost like a case-by-case basis.
Doctor, do you recommend these kids, such as when they're playing baseball, to wear masks?
Absolutely. Everybody needs to wear masks all the time. Right now with these variants in circulation, I understand it can be warm. You want to make sure it's a mask that fits you well. Practice breathing with it. I know that can be kind of a weird sensation. But yeah, right now I think it's time for everybody to mask up.
You talk about the vaccines and it being eligible now for, of course, adults, but now for teens. But the kids' vaccine is still in the clinical trials. Do kids really need this vaccine?
Well, that's an interesting question, and it's one we've been debating for a very long time. I think if we could guarantee that 100% of adults were vaccinated, I think there's a good chance that kids wouldn't need to be part of the solution. We talk about herd immunity, but unfortunately, we do know that there's a lot of adults out there who aren't going to be vaccinated. And so I do think kids, especially like teens, so kids over like 10 or 12, are really going to be an important part of the solution for getting us out of this pandemic. So I do think it's important for kids to be vaccinated.
And what are you hearing? I mean, are the side effects kind of the same as what we're hearing from adults that are getting the vaccine with the high temperatures and things like that?
Yeah, so kids, actually Pfizer just released some data yesterday indicating that basically kids had kind of the same response that adults do. The first shot was fine, the second shot maybe a little bit of fever, fatigue, headache, that sort of stuff, very transient. They got over it very quickly. They showed extremely robust antibody response. In some cases, their antibody titers were even higher than adults, which is not surprising. Kids have very robust immune systems, and efficacy was fantastic. There were 18 cases of COVID in the pediatric trial, and they were all in the placebo arm. There were 0 cases of COVID in the vaccine arm. So that's fantastic news. We're waiting right now for Pfizer to submit that data to the FDA, and we would anticipate within, say, like the next month or two that the FDA will review that data and expand the authorization down to age 12, hopefully.
All right, Dr. Edwards, we're going to wrap this up. We appreciate your time. So if families are kind of trying to figure out what they're going to do with their kids this summer, do you recommend just playing it by ear and just figuring it out and be smart?
I would say the first thing a parent could do if they want their kids to be out and about this summer is to go get vaccinated. The more adults who are vaccinated, the safer it is for our kids to be out and about.
All right, Dr. Amy Edwards from University Hospitals, thanks for being with us this morning.
Thank you for having me.